At the highest level, it's this concept of patient empowerment through access to health data.
This patient dimension of what's going on is perhaps the most exciting, right? The whole idea that these manila folders are not just turning into electrons, right? But they're turning into electrons that I, as a patient, can actually get, and I can share with people that I trust. And of course, Blue Button movement is the epicenter of that action.
The Blue Button initiative really started in 2010 when the Veterans Administration put a little blue button symbol on their patient portal for veterans, which meant you can click this button and you can get an electronic download of your health information. What does your health information or your health record look like? It's a list of medications, it's usually a list of your conditions, some basic information about you and your health history. So veterans really loved it, and they started to really use that service. So much so that others took notice. The Department of Defense, the Centers for Medicare and Medicaid Services also has a lot of health information to share. They serve through Medicare about 40 million Americans. The idea was taking off.
There's all kinds of data that says, look, better informed patients mean better outcomes for those patients, right? And so there's all kinds of innovation happening to try to take this data and this information to put it in the hands of the patient so they can actually pick the best doctor for their family, right? So they can actually understand better how to care for what they've got, right? So they can actually be a better and more involved partner in their own care.
It seemed so simple. It was really a way of crystallizing this idea of consumers getting access to their own information and, again, being empowered by it. So a couple years later, we at the Department of Health and Human Services, working closely with the White House, said, great, we think this is something that shouldn't be available just to folks who are maybe served by the government. We really want it to be nationwide.
It's of paramount importance to protect patient privacy, right? Paramount importance, right? And the principle at the heart of Blue Button, right, is that I, as a patient, right, can get secure access to my own data.
You're just pulling records from entities that already hold them.
This is actually relatively little known fact, which we had to clarify. HIPAA actually says patients have a right to their own data, right? This is in HIPAA. It's enshrined in HIPAA, right? And then we furthermore have clarified this recently to say that includes getting a copy of your own electronic information.
When we talk about health data, we often talk about the health record that your doctor has. But there's health information about you in lots of different places. Your health plan knows what kinds of procedures you've had and what they cost. So you've got clinical data as well as financial data in there. In some ways, the crux of the most useful data for many people is from pharmacies. What medications are you taking? How long have you been taking them? What are the ones you actually ordered and picked up? Which is more accurate, in many cases, a picture of what you're actually taking than what your doctor prescribed. What you do with it is up to you. Some folks will put it in a repository, some would call it a personal health record. Others will choose to forward it to another doctor to coordinate their care, or maybe again to another caregiver in their family, like your kid or your husband or your mother. Others will plug it into an app or a tool that helps them analyze it.
It's the patient's data. That's the thing, right? The principle that actually sits at the heart of the whole Blue Button movement, right, is that patients should be able to get secure access to their own information, to their own data. And that very simple principle, I think, is one that if we follow as a country, can help unlock all kinds of good for patients.